Welcome to Digital Health Talks, where we spotlight changemakers transforming healthcare through innovation. I'm Megan Antonelli, CEO of Health Impact and host of the Digital Health Talks podcast. And I'm here today with Jenice Larmond. Jenice is the Clinical Innovation and Excellence Officer at Neteera. Neteera has a FDA ambient monitoring platform which demonstrates what prevention-focused care delivers. With over 15 million hours of continuous monitoring, dramatic alert fatigue reduction, and early intervention that detects subtle changes before they become a crisis. I've had the opportunity to get to know Jenice over the years that she has been at Neteera. This isn't even our first interview, so I'm so excited to have you back on the show. Jenice, how are you?
I'm well. Thank you, Megan, for having me, first of all. Appreciate being here.
Absolutely. My pleasure. I know I've missed you at some recent conferences, so I'm excited to see you and catch up. And, I also want to congratulate you. You've got a recent promotion to the Clinical Innovation and Excellence Officer. So tell us a little bit about, our audience, what you do at Neteera and your background, because your background as a nurse and also on the payer side, I know has really informed so much of what you're doing there.
It's been a whirlwind kind of year for me, and very rewarding. I came on board with Neteera with fresh eyes, and that's the thing that I love about this is that, I came from the payer side and really was able to bring my years of expertise as a healthcare executive to the forefront here at Neteera. My goal is always to be able to merge and bridge that clinical divide between our technologists and the innovation and our end users. We want to make sure that what we're providing to our customers works, it translates well to them, and in the end really improves the delivery of care. As a nurse with over 25 years of experience, I've seen so much in acute care, post-acute care, payer, specialty pharmacy. Healthcare is so dynamic. There's always constant change. And so having a very broad view really helps me to help the team understand the many different ways we can apply our technology and really understand the different needs of customers. So we're tailoring it accordingly.
Yeah. I mean, we're just seeing so many nurses come into such great roles in these organizations that are providing, tools that are really at the forefront of clinical innovation. So as a nurse, your experience in terms of what that means to put all these, changes in place. And I think, what you've been able to do in terms of rewiring clinical culture from crisis response to prevention, what critical gaps in kind of early detection have you observed as a nurse, with this contactless continuous monitoring?
So as a nurse, fundamentally, the problem was simple as only, new patients with troubles in crisis. We find that normally you're checking vital signs, maybe depending on the facility, depending on the population, depending on the kind of services that's being provided. It's, every 4 to 6 hours or maybe once a shift. In some areas, it may be once a month for skilled nursing services, unless the patient has some kind of symptoms that you're monitoring. And so what we find is that, checking vital signs that infrequently, we may miss gradual changes over time. And, any signals for deterioration, such as respiratory rates creeping up or, subtle heart rate changes, there are patterns that cannot be identified if you're just doing spot checks. So, for us, our ambient monitoring really fills in that gap because we're providing true continuous data without, burdening the patient, no wearables to remove, no electrodes, that may cause skin breakdown for those patients, and no devices that are going to be limiting, the possibility of mobility. So we find that we are able to capture trends that normally are just not seen with spot checks.
Mm-hmm. Yeah, I mean, it is really interesting to think about, it really changes the workflow, right? I mean, when from kind of a reactive to a proactive care approach, and in some ways that has an impact on kind of the nursing, just the stress and the burden to the nurses as well, right?
Yeah. Yeah. When you're on average, most nurses are, it's unless you're in an acute care setting, it's not a one-on-one or maybe 2-to-1 ratio. Nurses, as you know, and this is not something new, they really have a full load of patients. Sometimes it's, 6 to 8, 9 to 10, or even more, depending on, what setting they're working in. And so being able to really transform how that nurse and support how that nurse can make that clinical decision as to how to prioritize her patient, it's really important. And you being able to seamlessly integrate that into that workflow as a support mechanism for that nurse really helps them, because again, spot checks don't really give them a full scope of what may be happening with that patient. Maybe it's not the nurse that's necessarily taking the vital sign. It may be a CNA or an MA, a patient care tech that is taking that information. And so being able to know that ambient monitoring is taking that and then delivering you, timely, appropriate alerts as to what may be happening or changes, it really frees up the nurse from that repetitive task, and equips them with trending data that, shows patterns. And that's such a difference in how we care for patients now, if you're in a non-acute setting, than what we can do with our technology.
Yeah. I mean, it's really a fundamental shift. And when you think about that, not just the going in and the taking of the vitals and the sort of what's getting missed, there's also the other side of that reactive side of the alarms, right? I mean, How many alarms? I mean, the nurses are going to go where the alarms are, where that happens. Mm-hmm. And so, I know Neteera has a smart notification system. How is that kind of changing, the clinicians, kind of focus in terms of early warning signals and, versus responding to alarms?
Right. Alarm fatigue is very dangerous. When everything alarms, nothing really matters. And we don't want that to happen. We become desensitized to it, and it becomes a problem, and then the tool no longer is useful. So constant reactive mode, without mental space to prevent or to think about what you need to do next, is not very smart. So, being able to use a proprietary algorithm that can differentiate a clinical, meaningful change and providing you that information is a game changer. It transforms our environment from constant crisis, because when you get that alert, this is something I need to action on, because it's being done within clear parameters. And then, you don't have that feeling of, am I jumping to every single thing every single time that something is happening? You want the team to be, feeling confident that the information that they're being provided helps them. So you're able to prioritize so completely differently now, knowing that you can rely on the information that's being provided to you, and when you're being prompted to take action. So managing that, I think, is so important. And we don't want to add more, fatigue or more noise to what's already a pretty busy day. I remember my days on the floor. It can be quite interesting. Nurses, sometimes we don't use certain terms or certain terminology because we can be a little bit superstitious, but it's because so much is happening. So anything that can streamline your focus is always a value add.
Yeah, no question. And I just, that shift, I haven't thought about it that way, but the shift of proactive care, when you think about the benefits, or when I have thought about the benefits in the past, at least, you're thinking about the patient, right? I mean, that proactive care is because you want to get ahead of something before something bad happens.
Yes.
But in fact, that it also reduces stress and it reduces the burden on your clinicians for sure, right?
Yeah, absolutely.
And that gives you that kind of cultural change for kind of being able to, recognize crisis before it happens. Now, I know you guys are in a lot of different settings, right? You've got home health, there's other, hospitals. Tell us a little bit about, what are some of the examples where that continuous monitoring is really preventing that crisis before it happens?
So I'm glad you asked. Just recently, I was with one of our customers. We had a great conversation. We launched them approximately about 3 weeks ago. And there's nothing better than hearing from your customer that says, yes, we were able to prevent something, and coming directly from them. So one of my one example that was just shared with me is that they had a patient that is mobile but is oxygen dependent, and took the oxygen off, went to the restroom, came back, and did not put it back on. Now, this is a patient that has orthopnea, and so our system was able to detect that there was an actual increase in the respiratory rate, and was able to provide that information to the nurse, and they went in and realized that this patient went back to bed, did not put back on their oxygen, and so now we're able to prevent an exacerbation, which would have caused additional problems for this patient. So, things like that is always great to hear, because we know that what we're doing works. We have, for instance, patients that, and another one that actually was shared with us too, from the same facility, is that a patient, we're able to not only do, respiratory and heart rate monitoring, but also behavioral. So patient exiting out of bed where we know we do not want that patient to be out, transferring on their own. We really want them to reach out to the nurse, and, but sometimes patients forget. They are just doing what they normally do every day. And so it's hard for them to realize there's a real purpose of us saying, please reach out to us so we can support you. And our system is able to alert that nurse to say, hey, my patient is out of the bed. They were able to get in and intervene and to prevent a potential fall, because if they were remained on their feet for much longer, they were pretty unstable. And so simple things like that, you have no idea how big of an impact, because a fall can lead to so many other things that can happen with that patient. A patient that's COPD and has some kind of exacerbation is just going to add to more complex care. And our goal is to not, when we're caring for you, we don't want to add to more complexity of your care. We're trying to, again, prevent you from either desaturating or, deteriorating. We really want you to be on the road to recovery. So things like that really helps us care better for our patients. And that's really our goal.
Right. Yeah. And I think that that ambient piece of it, where it's not interrupting and or disrupting both the care and the patient, are so important. But it makes me think of another side of that, which is kind of for the clinicians with the work, right? When we think a lot of these new technologies are coming in, we're installing them. There's a lot of pilots happening that people want. What about, where you guys are, what, from a technical standpoint, what do you guys integrate with? What are the, sort of processes and how is that, impacting existing workflows?
So Neteera currently integrates with most EHRs, standard protocol, which is either FHIR or HL7. We automatically flow our vital signs and information into the patient record without any manual documentation. Now, as you stated, a lot of times we're doing pilots, so we'll take it in stages. We may not initially do the integration because first of all, we want to make sure that, we're sending it to the right place. So we want our customers to be able to really understand the scope of what they're getting, making sure that when we do fully integrate, that we're sending the information to where they really need to, where it's best suited for the clinicians. I don't want a clinician to have to be searching 5 different places to get the information. So, from an IT implementation standpoint, it's pretty straightforward because, it enhances any existing infrastructure that rather than replacing something. So we're not trying to rework the entire workflow. We're just adding to your workflow. So sensors are simple to install. And the architecture it enables interoperability. And the health systems, as you know, a lot of them don't communicate well. So we want to make sure that when we integrate, that we have everything flowing in a way that is going to be seamless for that customer. Again, prevention is our key requirement for anything. We don't want to be heroic. We want an easy path to whatever we're implementing, to make sure that, we have a win for the customer, not increase complexity into the system that's already extremely complex.
Right, for sure. Just sort of the goal being to kind of create that frictionless implementation and get it in the hands of the clinicians so that they can maximize that value.
Yeah, I want them to feel it, touch it, play with it, tell us the things that they're really finding value out of, because it's amazing the ingenuity that just comes from clinicians and when they're fully engaged in the process. So.
Right. Yeah, no, absolutely. And I think when you provide that value, that's where you see that ease of adoption, So tell us a little bit in terms of the value, I mean, healthcare is a resource constrained environment. Whenever there's an implementation, there's many people who don't want to see it happen because it's going to cost money and there needs to be a return on investment. So tell us a little bit about, as you're doing the pilots and the implementations across these health systems, where is the value? What are they seeing? And why do they, continue to kind of implement and expand where they're implementing?
I find, and we have different kinds right now with our customers. We have a lot of early adopters, and that's because they're really looking for a shift in the outcomes, for early intervention. I think that just the idea of being able to prevent situations from escalating is really important. So, when it comes to when some of our facilities have reported at least a 30, sometimes up to 40% decrease through early detection, through occupancy and motion. So we're detecting, or we're helping to prevent patients from falling because we can alert them when a patient may be moving, and we really want that patient to be reaching out to the clinician. As you guys all know, fall-related injuries add about $14,000 per day in incidents, and this creates an immediate ROI if we can even save 2 to 3 patients from not falling. Especially with our older population, there are just so many things that happen post-fall once a patient has fallen that is just can be really detrimental to their overall, life expectancy after a fall. So length of stay improvements also are very important. We've emerged that when you're able to treat in place instead of having to escalate to a more higher acuity, that really saves dollars for that provider. But again, our goal is that as you use our technology, and the clinicians also are freed up from doing those repetitive tasks, sometimes not very quantifiable, but they're able then to shift and focus more on that proactive care. Sometimes that's not a quantifiable number per se, but it's the anecdotal report where the nurse says, this really is helping me get more done. I can, finish my documentation. I can, even see one more extra patient if it's in a home setting or an ISNP setting where we have clinicians that are utilizing so they can prioritize their day a little bit better. That really helps the overall. Sometimes you can't put a number on that. It's more of what's the quality of care my clinicians are not able to provide based on utilizing our tools.
Right. Yeah, no, it's an interesting way to look at kind of length of stay in terms of like shorter length of stay it means more revenue, more patient throughput, more, labor sort of optimization and throughout the day and throughout the year.
And depending on the setting. So in our hospital settings, acute care settings, we want that shorter length of stay. But in our SNFs, we don't want to have to send them back because then runs into readmission for the hospital. But if you can treat in place, early what is happening with your patient, you can take those steps instead of having it to be at a point where I now need to call an emergency because I cannot care for the patient because we didn't catch what was going on with that patient in advance. Right. So that truly makes a difference to the bottom line.
Yeah, no, it's super interesting around how you guys have really shifted from, just the sort of length of stay to prevented readmissions. And I think that what it comes back to is prevention, right? And population health, and how, that shift from, even as we talked about before, sort of acute, alarm fatigue and always responding to the sickness and the illness, but taking a step back and looking at how, these signals and these early warning signs kind of can help us determine what prevention at scale looks like. So tell us a little bit about kind of Neteera's vision for that, and how the technology, will support that as we move from this sick care system to a preventive model.
I think one of the things, and as a clinician myself, it's so much more rewarding when you're able to capture something before it escalates, because you are really working to, educate your patients, care for them, prevent them from any exacerbation. You don't want your patients to experience difficulty if you can at any cost prevent that from happening. And so I think Neteera's goal is that we want to help our clinicians to just think differently, and giving them the tools to do that, I think is one of the best things we can possibly do. The more we can treat in place, people really want to age in place. We talked about that a little bit before. People really want, to be in a home setting, whether it's a senior living setting, whether it's your SNF, whether it's your actual home. They want to feel like I can get the care that I need without having to escalate into an acute care hospital setting. So our goal is to use the ambient technology and our proprietary algorithm to really help that process along. Seniors don't do anything, when we don't want to make it complicated for them. So we wanted the technology to work invisibly so they're comfortable. I mean, I have in-laws now, they love using their Alexa, because they can, talk to it. It's in the background. It's easy to use. So we want that these subtle things that are happening, over time, developing and understanding the patient just gives you a better insight into how we can better care. Sharing that information with, the clinician, the PCP, it's in a manageable way, because again, we don't want to overwhelm them. In a manageable way, I think is really going to help how we care for this population that continues to grow, continue to have chronic illnesses. It's not going away. We still have quite a few more years to manage that. And I think being able to manage it in an effective way can only be a win-win. I think technology that protects and without restricting monitoring and without burdening enable independence, I think is really important for our seniors. Or anyone actually that has to be monitored. When you remove any compliance barrier where I don't have to remember to put on a blood pressure cuff, I don't have to remember to, do a glucose stick, I don't have to, be tethered to electrodes, that really helps anyone to be more compliant. It's almost a set it and forget it mentality, which, I still remember that commercial very well, because it has always been one of the things I'm like, yes, that's how I wanted to set it and just forget it. But I think it really helps, again, for then that patient or that clinician that is working with that patient to feel like I am being cared for in a proactive way, versus here is another problem that I have to wait till it gets out of control before I can take an active, get any action done on it. So I think that's one of the things I think is so important in just where we are and why technology and combining technology and clinical know-how and expertise and supporting it in a way that is very easy for us to see and identify is going to be a game changer, because our population still grows, that chronic population is growing more and more, and anything that can help our clinicians see better, I think it's going to be vitally important for, to be able to care in a more effective way.
Absolutely. I mean, talking about the senior population, and the senior tsunami, if you will,
exactly.
then, sort of we sit in this sandwich generation where we're taking care of our in-laws and our parents and our kids. And I'm just like, I need a Neteera in every room in the house. I need one in New York. I need one here, and so this, it's like I'm growing impatient because I know we have to make sure it works in the hospital setting first. But then as we get into senior living environments and where people are and where people want to age in place, there are so many points of value to this for, not just nurses and physicians, but family members and caregivers and all of that.
You and I are we're in that sandwich generation. I can completely use a Neteera right now because I need to know what's going on with my family members. They have 1 to 2 chronic illnesses, the standard, MO that they fit out there. And you always want some more insight because, again, I'm the one that's following up and helping the doctors understand what their care has been. But being able to get insights ahead of time so I can paint a better picture really helps, I think, me help them live a more stable, independent life.
Yeah, no. And I just, it's so the next step and it's that future and we're just kind of waiting for it to happen. Right. Or some of us are actually making it happen. Like,
I just went to a conference in Georgia, the Georgia HIMSS conference yesterday, as a matter of fact, and it was very future forward. The theme was quite appropriate, and it was exciting to see that a lot of things that we talked about maybe 5 years ago, not even that 10 years ago, are being implemented. And it's not only happening, and it's happening in various different healthcare settings. You have hospital settings, SNFs, home health is doing things. Everyone is really looking into understanding how important it is that we need to utilize the technology we have to really augment the care that we're giving, because there's so much information coming at you. Having something being able to be synthesized so you can understand it easier, so that you can be more effective in what you need to do, you can't go wrong with that.
Right. No, 100%. And how we always have our 5 good things segment, and we go to our 5 good things. I think maybe you just already covered it because that future state is that's what gets me excited. But in our last couple of minutes, as you think about, what is good in healthcare, what's good, what's coming, is there anything else you would add to that in terms of, what's next and what the real bright spots are?
So, I am all for ambient technology, as you know, but the thing that I am really excited about, a lot of places have deployed it for our physicians. I'm really excited about the deployment for nurses. I think that's going to be a game changer for us with all that we have to document. I'm really excited at seeing nurses really getting into those spaces with, technology companies, bringing to light what we know happens at the bedside and how we actually work. I see that excitement going on, and I also, what I'm really excited about, because that was another thing that just happened, and I think because it's so fresh in my mind, at that conference we had so many student clinicians and healthcare. They were really excited. They were right there in the forefront, understanding. I was saying it was a moment where you can clearly see the baton of, healthcare ITs being passed on to the new generation. So they're already ahead of the game. I feel like we were catching up, and, we may be a little bit savvy with some as we learn, because a lot of us, I didn't start off with having internet and a computer but this generation, that's all they know. So I think their adoption of it is going to be amazing and faster. But I like that they're getting involved now and really understanding where we were and kind of saying, okay, I totally know where you are. You're passing it on and where we're going to take it. I think that's the amazing part of all of that.
Yeah, no, it is. It's exciting and the future is bright. And these kids, well, it is amazing. Just the level of technology that they've been surrounded with their whole lives and what that's going to mean for the future. But, well, thank you so much, Jenice. I could talk to you all day. I love hearing your great perspective. And I just think there's so much to the technology that Neteera brings to patients and health systems. But in terms of getting in touch with Neteera, obviously the website, you're on LinkedIn, folks can find you there, right?
Absolutely. Yes.
Awesome.
Look forward to connecting with anyone, but there's so much, and thank you for having me. I truly appreciated being able to have this conversation. It's exciting times.
It is, Jenice. Thank you. Thank you for joining us. And of course, Jenice, so very likely be at our future health impact conferences, as well as other conferences around the nation and as we approach this fall. So, I think what's great about this is it shows us that healthcare doesn't have to operate in perpetual crisis mode. I think, talking about what Neteera does, it tells you sort of that this ambient monitoring is actually fundamentally rewiring clinical culture from reacting to emergencies to preventing them before they happen. So, for leaders in post-acute care and aging in place, it's not just about better technology, but about the cultural transformation towards prevention, focused care, and value-based care models demand. And so while reimbursement and continuous monitoring and hospital at home, continues to grow and build the case for reimbursement, these technologies that support it will be there. So it's not really, it's stopping the question of whether or not ambient monitoring is transforming care delivery is not even there anymore. It's kind of, when will your organization adopt and lead, or will they shift and follow? So thanks again for joining us on Digital Health Talks. And thank you to our audience. This is Megan Antonelli. Until next time, keep innovating.